Welcome to Wellspring on the Air. This is Tova, and I am the president and co-founder of Wellspring Counseling. And with me today on this program, I have the other co-founder of Wellspring, Christine Schlottman. Hi, Christine.
Hi there. Nice to be here, Tova.
Likewise, likewise. And we also have one of our great therapists with us, Mark McGowan. Mark, welcome to the show today.
Thank you, Tova. Privileged to be here.
And take a moment, Mark, and besides working at Wellspring as a great trauma therapist, what else do you do?
Well, I also work at Florida International University as a professor. I'm also Associate Dean of the College of Public Health and Social Work. So I do research and teaching as well. I teach a course on disaster mental health. It's the only one in the university I'm teaching it this summer. So it's very relevant for this time to be talking with students about a real live mass casualty event that's happening right around them. So it's really, I think, a challenging but also exciting time to be a student studying about how to help people in these circumstances. So.
And it is unprecedented times, as people keep using that word, right? So, so our show today, for those of you who are listening with us, is about a COVID protocol. So we want to talk today about a tool, a free tool that Wellspring's giving away, that is a stress reduction and anxiety reduction tool, a self-help tool that we will train you for free to go home and use to help reduce your anxiety about COVID and COVID-related fears that you may have. But so that's what the program's about, but we're going to kind of ease into it and talk first of all about what are some of those anxieties that we have about COVID. And then because we're having so many other stressors right now, I think we really need to address some of those. So let's just talk about these unprecedented times that we're having in America. I heard this funny, I saw this funny joke today that was about welcome, it said, congratulations, you've survived through May of 2020. You have now entered level 6 of the Jumanji 2020. Now be prepared for hurricanes.
Right.
I just feel like that. I feel like it's a year, the 2020 year of this and then this and then this, and we just get through one level and we just suddenly enter the next. And so let's just spend a few minutes. What are these major anxiety producing issues happening in our world today?
Well, clearly there are many associated with COVID, Tova, and we've just been talking about them these last 2 months, particularly last 2.5 months, and some of the things that people have experienced. It feels like our world has gone upside down, literally, from where we were in the beginning of this year to today, and trying to adjust to new routines, a new life of social distancing, often feeling more disconnected and isolated from those in our lives, our families, our friends, and trying to be creative in how we adjust to this new, quote, normal, as they say.
New ways of living, yeah. So what other things? Let's chat about.
Well, there's some specific things that people feel, but you can also see there's been well, at least if I can speak personally, some of the issues I originally felt a few months ago may be a little different than what they feel now. At the very beginning, I was very, very, very fearful, particularly about getting it, and it was a mystery about how we get it. That it could be almost airborne, that surfaces could be ways to be to get it. So it was very difficult for me, at least at the beginning part of the process. But things have changed, and now we may have other kinds of fears. The tumbling effects of things like medical care access has been one thing that's been recently talked about, that we're not going to our healthcare providers for the reasons that we should be seeing them on a regular basis. And that's creating some anxiety in people now about not being able to, because they're putting priority on COVID cases and not about other healthcare cases. People can't access their mental health providers in the traditional way. This is an exception. And I think we've done really a good job in terms of moving it into telehealth. But those are some other things that I think have caused some issues. But maybe the family income, the employment concerns, the anxieties have really started to hit home now. And that's been a real effect. Those are just some things I can mention.
Yes. I know some people have had trouble sleeping. I remember at the beginning, as you mentioned, Mark, sometimes things have transitioned from the beginning to currently. I was waking up at 5 o'clock every morning and just sort of trying to figure out what was happening, how to live, how to set a routine for the day. Just sort of hyper vigilant almost, trying to figure it out and understand what was happening in our world. I know many families have experienced some stressors, being together all the time, feeling like they just never had a break. We're hard to find space and time alone. And of course, children were home from school suddenly, almost from one day to the next, which was incredibly challenging. And I spoke to many parents over these last couple months who have just, sometimes been pulling their hair out, trying to really figure out how to do this school situation and help their children the best way they could. So that too has been disruptive. And even for the children and the adolescents, those who've not been able to graduate as they normally would have, just the normal routines of life, that the rhythms of the school year has been very disrupted for people. And yeah, go ahead, Mark.
I was just going to add to it. The other reality is that some of us have lost people in this event.
That's true.
My aunt, I lost my aunt to it, who was trapped in a nursing home, and of all places, in a rural part of England. She was in a nursing home and then contracted it there. And the other piece of that is, and the saving grace, perhaps in that one case, was that my cousin is a physician, so was able to be by her side in her passing. But many people aren't able to do that.
Yes.
And so those losses have been magnified by the fact that they can't be with them, and that's been a very difficult issue for some people.
Yes. I've been very much walking alongside different people who have lost loved ones also, and have been sending out cards to people and just realizing the impact is far reaching, and to not be able to be with one another during this time has been especially difficult, because that's the very last chance to say goodbye, and often they haven't been allowed that because of the hospital situations.
It's discouraging to talk about this list and to think about it, but one of the things, and the reason for the timing of this free tool that we want to introduce for reducing anxiety related to COVID, is that we do seem to be shifting from where we were 2 months ago to where we are now, the society. So as we return to work, it's interesting, everyone was desperate for everything to open up. And yet, in reality, they're discovering that even though things are open, people are not necessarily choosing to go out. My husband owns a business. I have friends who own businesses, and they're asking their employees to come back, and they're very hesitant to do so. And so whether those anxieties are just about a new normal, they're anxious about, again, maybe anxious in a new way about the possibility of getting, the disease. They're anxious maybe about how to navigate the new routines, because everything's different where they go, how they check in, where they put the things, temperatures as you walk in, all sorts of those kinds of things, in returning to work, as well as some parents now are returning to work, but their kids are still off, and what do they do there? As people return to work, what do you think are some of the other anxieties about trying to create, it's not back to normal, it's entering a new normal, right? So what do you think those anxieties are related to the new normal, whatever that may be?
Good question, Tova. And again, there's a lot of uncertainty, just as we've been feeling all along, as we keep saying, well, maybe it will be like this, or maybe it will be like that, or we don't quite know when. Are children going back to school or not? So there's still a lot of questions out there, even about when and if and how people will, for example, be returning to school. And then in some cases, some businesses are saying it's an option for you to return or not. You can still work from home. So there's some flexibility, but in those cases where there's not, I think, as you mentioned, that people are concerned that maybe if we move too quickly, they may catch the virus or may be more vulnerable.
So I think you kind of, uncertainty is the anxiety.
Yeah.
The fact that I don't know is anxiety producing. We can't plan for it because we're not sure what it is going to be. So let's just talk. So we've got a tool that is specific for helping reduce anxiety related to COVID issues, right? So Mark, tell us how you came on this, and that we at Wellspring have taken it on, said, let's train people in this, let's give this away for free. So how did we get introduced to this?
Well, as one of the networks I get messages from is EMDRIA, which is the EMDR, or eye movement desensitization reprocessing therapy organization that's international. And they had mentioned that someone had come up with some modified protocol that they had developed. And actually, I knew the person who had developed the original protocol, which is the immediate stabilization procedure. It's Gary Quinn, Dr. Gary Quinn, a psychiatrist in Israel. He had modified his protocol that was developed for crisis situations that often happen in the Middle East, of course, but also elsewhere. And so he modified this protocol and was launching it. I saw the email sometime in March, and announced a free training for anyone. And there was a worldwide participation. We had about 500 people in that training room. It was very interesting because it was a single session, very focused training, but also a training for us to train others on self-care procedure for coronavirus. So it was something specifically developed for the worry associated with coronavirus. And so he had done the training and we got trained in it. And it just seemed very appropriate, and the only one I knew of that was readily deployable for anyone with worry. And for all of us who got trained in it, we also felt a sense that we benefited from that because we're all in the same boat. Unlike some other disasters that we're involved with, everyone in that training is dealing with that worry. So you could actually experience the change in that session, being trained to deliver this. And so it was very exciting to be able to be part of that, and then realize that's it, we can do it. And the idea that people can be can do their own self-management in this was really exciting to me. So they're trained in this, and then they take away the procedure for their own self when they need help on it. So that's how I found out about it.
Okay, and then being a great team member, you brought it to us at Wellspring, and it is in connection with a treatment we already use, which is called EMDR. And so our team was very comfortable with the training, very happy to take it on as a specific thing we could train our clients, and even the people who aren't our clients, to just maybe the people who are normally, their normal state is as pretty healthy, emotionally healthy, but even they're discovering they're tipped. And so could we just give them a little self-help tool that they could use to reduce the worry and the anxiety related to COVID? So we said, let's do it. So here we are, we're launching it, we're telling people we're doing it, and we're giving it away for free, at least for a few weeks or so here. And as long as people are wanting it, we will give that away for free. It was given to you for free, Mark, right? And there was kind of a desire of the originators of this to say this needs to be for free.
Yeah, and Dr. Quinn was very generous in that training, and also in the protocol, and deploying it worldwide for people to do the training on their own. So the great thing about this is that I think everyone can relate to it. You don't have to be have super high anxiety or PTSD or anything. It'll manage the levels of worries that you can bring to it. Things like, I'm afraid I might get the virus, or it's my fault that I infected others. I'm alone or isolated, or I'll have no money. Those kind of the concerns and worries that regular people have because of coronavirus. And this thing helps us to be able to manage those.
It just reduces that worry a little bit.
Yeah.
And they can do it on their own afterwards. Whenever they feel the worry come up, they can use this protocol, right? And just kind of take it down a notch, right?
Yeah, that's the intention. Yeah. Yeah.
All right. So on that point, I think that's a good place for us to break. So if you are just joining our program, you're listening to us. This is Tova with Wellspring on the Air. With me, I have Christine Schlottman and Mark McGowan. And we're talking about a free COVID protocol to reduce COVID worry, COVID anxiety that we are wanting to give away to the public. And so if you missed the beginning of this show, you can find us at Wellspring on the Air on our website, wellspringmiami.org, or on your favorite podcast channel. And you can catch the beginning of this show. If you're otherwise, stick with us. And if you're just joining us, we're going to be right back. And after we come back, we will be talking about what exactly is the protocol, how does it work, and how someone can get this free tool. So just stay with us, and we'll be right back. Pause, edit. Are you guys good to keep going?
Yeah, just hold on a minute. I just want to pull the protocol out, so it's sort of nearby. Yeah.
The other thing we want to
give it all away too much. No. How does it work? I'm going to, and then let's talk about EMDR, and we can talk about a little bit, Christine, towards the end, when this isn't the right protocol, but we want to use EMDR or other things.
Sure. But do mention about the little testing they can do, the self-care, not the self-care, the measure that kind of could draw them in if they want to self-assess.
Okay, so, that's very good. So let's get that in at the beginning.
Yeah.
But the question is, where did they get that link from our website? I'm talking about the public version, not the one that we do pre-test or post-test, but there's one that we have that gives them a self-score and they can realize, oh, maybe I do have elevated.
Did you solve that with Monica?
We didn't.
Or is it just a pre-test? Don't we have that?
Well, that's my question.
During the seminar, we don't have it in general?
That's what I'm hoping is I don't know if we have that general link on our main website.
Well, I think we'll say it's on the website and make sure it's there, because I actually think I think it was there. We put it in the email, I think. I'm not sure. So
yeah, so it's the general public version, which doesn't have doesn't ask for any demographic information. It just gives them their score and tells them, if you're worried, contact, here's some resources, and the beginning is Wellspring, but we could.
Okay, so I'm just going to refer to the website for it, and we'll just, before we launch this, we'll make sure it's there.
Okay.
That's a good idea.
And that could be a lead into to the protocol.
Yeah, okay. Mm-hmm. All right, so you guys ready? Mm-hmm. Okay. Welcome back. This is Tova with Wellspring on the Air, and with me I have Christine Schlottman and Mark McGowan, both trauma experts and helping people recover when really bad things happen. And today, if you missed the beginning of our show, you can find us at Wellspring on the Air on your favorite podcast channel, or on our website, wellspringmiami.org, and you can get the beginning of this show. Today, what we're talking about is a self-help free tool that we're willing to train people in to reduce their anxiety, their worry about COVID-specific events or worries as people are returning to work, and as they've lived with this event now for a couple of months and trying to make sense of it all, and now they're looking at what is this new normal and how do I go back to work, and what happens next. A lot of uncertainty there still for our children, our jobs, our economics, as well as the major other unrest in our country. We have a lot of anxiety. But again, this is a specific tool. It is free, and it is a self-help guide. We will train you to do this yourself to help reduce your worry. So Mark, you're the one who introduced this tool to us. So before we go into a little bit of details of the tool itself, so how does someone know if they are actually particularly worried about COVID?
Sure. So they can have their own kind of sense that they're a little overwhelmed with worry about COVID, and that could be one way of knowing that they need help, or at least they want to participate in this free training. The other way of doing it is and I was concerned with that question, and as a researcher, I like to promote reliable and valid tools that help us really assess the level of whatever it is we're feeling. So I was very surprised to learn that people had already developed different scales related to the level of fear of COVID. And there was an international measure that was developed in the UK called the Fear of COVID-19 scale. And it's a very brief measure. It's got 7 items, scoring from 1 to 5. And so what I did with that, with the permission of the developers, is we put it on a site in which it self-scores. So people, when they go in, and it's anonymous, will go in and they'll fill out the little questions, the 7 questions, and they'll get a score that ranges from 7 to 35. And if your score is on the high end of that, that might indicate that you want to get some coaching about that. And so that's one of the things that we're putting on the website at Wellspring for people to self-assess. And then if your score is elevated, then you can reach out and we'll help.
Okay, so let's just say that again. So on our homepage, there will be a link. Our homepage is wellspringmiami.org, and there'll be a link to a fear of COVID-19 scale, and they can anonymously take that. And then if they feel like they have a little bit of a high scale, or they just feel it without the scale, there'll be another link on the homepage to sign up for the training, and then someone will reach them and schedule the free training with them. So basically just a sense that, hey, sometimes people want a scale like that because they want to know, am I normal? Am I above average, below average? Is everybody as worried as I am or not? And honestly, maybe everybody is, and everybody would score high these days. So again, it's not just really about relative to other people, but I do think we kind of like an assessment. We like to know, like, I'm kind of high on this. I really am genuinely worried or anxious about it. So that's a scale that we can use to kind of sense that, and then people can sign up for the training, right?
Yep. Mm-hmm.
All right, so tell us, the training is, how long does it take?
Well, it's less than an hour.
Okay.
To do this, I would say probably from 20 to 50 minutes, right, Mark? Something like that. We actually all did it ourselves as therapists at Wellspring. And I know when I did it, I went down. My number was 7 at the beginning, and I went to a 3. So I was moving down and feeling better as I did the training. So I thought, wow, this really does work. It really does help us. And then I talked to other people that had done it, and they too felt better. So it's pretty quick. It's not a really long, involved training, but it's simple and it's direct, and it leads us to feeling better and reducing that anxiety that you've mentioned, Tova. That is what we're looking for. In general. Now, it's not every time, but in general, yes.
In general, yeah. Just a little edge off, just so our audience knows. So we practiced this on our therapists. We do try to practice what we preach at Wellspring. And then we did another round where we practiced it on our admin team, because they weren't in on our therapist round. And across the board, we did have reductions in our own anxiety as we return to work, because we've been doing telehealth, and our people are thinking about coming back, and do they, and when, and how, and we, like everybody else in this society, are facing all of these same issues. So we've practiced it, we do like it, and we want to give it away. So the tool is, half an hour up to an hour of training, and then they go home with a handout. Is that right, Mark?
Yeah, a handout. It could be an electronic handout, or physically. If you print it out, you can keep it with yourself. So that's the intention. Yeah. So
there's just a guide that they learn how to use it, and then they practice it, and then they can use it on their own when they're feeling anxious. Is that basically it?
Yeah. Mm-hmm.
Okay. All right. So let's just talk. We have a few more minutes left. So this tool is in connection with the EMDR. So eye movement reprocessing and desensitization. I'm the one who brought this to Wellspring, and I just messed up. So that's fine. So eye movement, desensitization, and reprocessing. And but Christine, you are the best person, I think, on our entire staff at using the EMDR, using it the longest other than me, but with more experience, I think, now over the years. So tell us how this is similar or different from EMDR.
Okay. Well, EMDR is much more involved and has a much longer protocol. And we're looking at more deeper issues that people are dealing with, possibly disturbing events that have happened, or trauma events, or just anxiety or depression that they're struggling with currently. So, and it could be current, it could be past. Again, this COVID-19 protocol is really geared just for COVID-19. That is the main focus. So it's very specific and it's brief and not as involved at all as what our EMDR therapy would be. But one thing that we do with the COVID-19 is we do bilateral stimulation to help us bring down that anxiety and help us relax. So that's the part they took from EMDR.
So what is bilateral stimulation?
Okay, so we can do that by tapping, we can do it by using a machine, but basically the idea is we're accessing both sides of our brain so that we can integrate whatever it is that's disturbing or causing anxiety and help to reduce that. I mean, that's a very brief explanation, but
Yeah, so
it does help.
We stimulate parts of our body, either our ears or our eyes or our senses, first one side then the other, so thus bilateral back and forth. And while we do that, we stimulate both hemispheres of the brain, and that has a neurological piece that plays into recovery of things. So and the protocol, so EMDR is deeper, it's often trauma, it's a longer session, it goes into the past. This is very distinct it's really a future reduction. It's how do I just think about this future anxiety and make this specific thing feel a little better? Is that exactly about right to say it that way?
Yes.
Mark, any thoughts to add to that?
Well, yeah, and that's the difference between what EMDR is really focusing on, sort of past trauma, and this really focuses on present concern, present worries, or even future worries that really haven't happened yet. And it focuses mostly on stabilization. EMDR is much fuller than that.
Yeah, and the word reprocessing in the EMDR, the reprocessing is really to stimulate, activate, remember, recall an old event, and then to reprocess it, to think about it from a new standpoint and to digest it and to process it. Whereas this is not that. You're not reprocessing anything, you are just altering how you feel about it in the very present moment. Right? Okay.
Yeah.
So very specifically, and well, anything else you guys want to add? Do you have any particular stories about this you've been using with your clients or anything that you want to share?
I've done it a couple times with clients, and in both cases they went down in their numbers and felt better and even felt sleepy and tired because they were so relaxed. So it was surprising, but also positive, and they went away feeling better. So that's the purpose of it, and it was successful, and I was happy for them because they had been feeling a lot of anxiety.
Okay. Well, I want to make a few comments before we wrap up, and I just want to comment on the fact that we're introducing a tool for reducing worry and anxiety for COVID-related issues. We are still available for people who are, maybe their anxiety in the present is because you're being triggered from PTSD over old things. Right now we have so many things happening. We have violence in our community. Maybe people have opiate PTSD over safety issues. Maybe people have hurricane fears as we move into hurricane season, and they also have old issues related to having survived other hurricanes or other natural disasters. The bigger, deeper things are more appropriate for EMDR, for individual therapy, for some of these other things. So I just want to say that to our audience, go to our website, ask for an appointment. We're still having reductions in our discounts through June 20th at least, to try and get anyone in who needs to be seen. I want to comment on the fact that our numbers are way up. We're up about 50% in our volume because I think I just crunched those numbers today. And I think that's reflective of how anxious our people are in our culture, and people are coming in and they're needing it. And we just want to be available for that. We want to give away free things for people who are maybe normally steady and are just a little worried about COVID. But if you are really triggered or really in distress, then come in for regular therapy. Don't come in, or do telehealth. Eventually we'll be coming in, but get regular help. I also want to make a plug for a stress reduction webinar, which will be on June 10th with Lyle Green, one of our other therapists, who's talking about you can't change the stressors, but you can reduce how they affect you, and you can manage, you can learn tools that help manage it. This is one tool of managing the stress specific to COVID. But that webinar next week, June 10th at 12:30, that webinar is also free to our community, and Lyle will be teaching us some of the other specific things we can do to manage the stressors. Our response is in our control, but the stressors, most of them aren't. Some of them are. We can work on some of those too. But so we just want to make those plugs for other things along those lines. So anything, last comments from each of you about this?
I just want to welcome people to join us. Check out our website. In fact, we have many podcasts and a lot of great information about probably any mental health issue you have a question about. So do check us out in our website. And also, if you're interested in this COVID-19 protocol, it's going to be there and it's for you.
And I just say we're here to help, and we have a real interest knowing if what we do helps people. So we are collecting information from folks about what we do, and to make sure that we tailor our services and interventions, including the self-care protocol, is effective. So we're excited to be able to have something that has a good foundation, but we don't rest there. We also are looking at the data continually to see that we're actually helping. And the anecdotal evidence is that it's working quite well. But we're also going to be looking at some of the harder data about that. But we're here for you.
And I love hearing that from Mark, because he's our researcher and he's pushed us. We're not just going to do the protocol, we're going to test it. And I think that's consistent with our values at Wellspring, which is that we want to always use the very best practices in the field. We want to know that what we do works. It's not just laying on a couch and we're making stuff up. We're using evidence-based therapy tools that work. And so here we are again, researching, giving it away, and hopefully that reflects our heart for bringing health and restoring hearts and minds at Wellspring. So on that note, let's wrap up. This is Tova and Mark and Christine with Wellspring on the air, because hearts and minds matter.